So gum disease is an inflammatory disease, and it has many, many risk factors. Let's say that the most important risk factor, and something that we can tackle very, very easily in the dental practice, is the amount of plaque accumulation, so the buildup around your teeth. There are also a lot of other risk factors to gum disease that I always assess during my consultations, and they include the presence of some lifestyle-related risk factors, including smoking, nutrition, lack of physical exercise, so physical inactivity most of the times, together with the presence of other systemic diseases. So gum disease as a whole is usually compared to diabetes because, again, it is a chronic and inflammatory disease, and most of the times they are associated with each other. So research has found that there is literally a bi-directional relationship between gum disease, so periodontitis, and diabetes, together with other chronic inflammatory diseases. The problem with gum disease is that most of the times is asymptomatic. If we're talking about the presence of early signs and symptoms, for sure, we can identify gum bleeding, not only that just spontaneous, but also bleeding, for example, when brushing or when using either the floss or the interdental brushes, together with sensitivity to your teeth or the feeling of having puffy, tender, swollen gums. And in the most severe cases of gum disease, we can have also the presence of mobile wobbly teeth. But in that case, really, we're talking about the severe stages of gum disease. And ideally, we would like to see a patient whenever the stages and the severity of the disease is, again, during the early phases. Okay, we usually classify gum disease into 4 stages, according to the new classification that was published recently in 2018. And it goes from stage 1 to stage 4. Stage 1 is the very, very mild form of gum disease. And then we have stage 4. Stage 4 is like the worst case scenario, so the worst phenotype of type of gum disease that we can have. Right before gum disease, which is basically an irreversible bone loss around your teeth, we have what we call the gum inflammation, so the gingivitis stage. Gingivitis is basically only when you have gum bleeding without having lost bone around the teeth. So ideally, the best way that we have to prevent gum disease, and especially to prevent from having very, very severe stages of gum disease, is to actually identify patients with gingivitis, so only with gum inflammation, treat them while the disease is at the early stages so that the patients just need a minimum amount of treatment and care. And then basically we prevent them from developing the more severe stages of the disease. Oh, that's a tricky one. Gum disease, again, is a chronic disease. Again, it's very similar to diabetes. So as a chronic disease, gum disease cannot be cured in the sense that there's no medications, there's no treatment that as periodontists that we can do in order to literally make gum disease go away, okay? As with any other chronic disease, also for gum disease, the goal is to stop the progression of the disease. So whenever after we've made a diagnosis, the goal of the treatment for gum disease is to stop the progression of the disease. And once we've stopped the progression of the disease, the goal is to keep this, what we call periodontal stability, meaning the inactive disease, stable over time. And how do we do it? 2 ways, monitoring and maintenance. Most of our patients, after they've received gum treatment and after they have reached what we call the periodontal stability, they're just going to need to see the dental hygienist for very, very thorough hygiene sessions every 3 months. And then they're going to need to come and see me for a checkup, which is the monitoring part. So meaning having a full exam of your gums roughly every 6 to 12 months, depending on the risk profile of the patient. Okay, so whenever, according to the new guidelines for the treatment of gum disease, they were published in 2020 by the European Federation of Periodontology, and then they were supported also by the British Society of Periodontology and then by the American Academy of Periodontology. The treatment for gum disease is has a stepwise approach, okay? It always starts with the first 2 steps of treatment. The first 2 steps of treatment basically involve the removal of the build up above and under the gum line, in addition to basically controlling for all the risk factors for gum disease. First of all, giving the patient very, very thorough oral hygiene instructions. So it's not about just brushing for a longer time or flossing for a longer time, but it's about creating new habits for the patient so that their 5 to 10 minutes that they use to perform the oral hygiene habit are actually effective in removing the supragingival plaque. During these phases, during the first 2 steps of gum disease treatment, we also do something that's quite new and that's something that my research has helped, let's say, shed a lot of light on, which is basically we talk about lifestyles. We know that there are so many lifestyle-related risk factors to gum disease, including nutrition, physical inactivity, stress levels, and sleep quality. And it is also part of this initial phase of the treatment of gum disease that we actually that I always talk to my patients about also how to improve their lifestyles, how to make, let's say, very, very tiny changes on a daily basis to their nutrition or to their physical exercise or to the sleep quality, so that this can not only let's say, help in the success of the first 2 steps to the treatment of gum disease, but they can also, let's say, help ameliorate their systemic health. Then there are other 2 steps to the treatment of gum disease, step 3 and step 4. Not all patients actually need the step 3 to the treatment of gum disease. The step 3 usually involves the performing minor gum surgery, okay? But only a few patients actually need minor gum surgery, because in most of the cases I manage to, let's say, stabilize the gum disease with a non-surgical phase. The last steps to the treatment of gum disease is called step 4. During the step 4, it is basically what all our patients need, and it is what we call the supportive periodontal care. And it involves basically 2 things: the monitoring and maintenance of the patient. And it's something that the periodontist usually does together with a hygiene team. Most of the patients that have undergone gum treatment, so the treatment for gum disease, probably would need supportive periodontal care, so hygiene sessions every 3 months, and then, let's say, some regular recalls with the periodontist every 6 to 12 months, basically to check that the stability that we reach for the gums is actually still there. So this is the overview of the stepwise approach to the treatment of gum disease, which involves these 4 steps.